Before we fully dive into newborn care this semester, I wanted to just briefly go over what the role of nurse midwives is in newborn care. So the midwifery core competencies document you should already be familiar with because that's what starts with the hallmarks of midwifery. So after you see the hallmarks of midwifery, the rest of the document goes through what is expected for essentially a new grad to be able to do and know how to do upon graduation. So our core competencies of what a nurse midwife scope is. And so it goes through primary care of women, antepartum, intrapartum, etc. And part of that is newborn care. So I want us to go through the document and just see what it is that's expected of us, what we should be able to know. So right from the beginning, we see that our scope starts with newborns from birth up until 28 days of life. And that seems kind of like a random time frame to stop, but essentially a lot of the vaccines start at about a month. So we have the Hep B vaccine that's available at the time of birth, but then the rest of vaccines don't start to roll in until about a month. So having our scope end at 28 days means essentially that nurse midwives don't need to stay on top of knowing CDC recommendations around vaccines or incorporating all the newborn vaccines into their practice, for example. Now, I would say that the vast majority of nurse midwives in the U.S. provide very little newborn care, probably most commonly after they clamp and cut the cord, they're done with newborns, with the exception of perhaps breastfeeding support. However, for us midwives that are out of hospital, it's a very central part of what we do, in that we are the newborn's primary care provider from birth until discharge. And even though discharge may only be a few hours after the birth, if we didn't have that as part of our scope, we really couldn't do what we do. And a few years back, it actually went to ACN and they were considering taking newborn care out of our scope, given that definitely the vast majority of us aren't using it. But it was the birth center midwives who really pushed to keep it in our scope. In home and birth center settings, it's common for midwives to be the primary care provider for newborns following the birth until discharge, and then typically there's at least one home visit. And then it's not uncommon for them to continue to see both mom and the baby for the postpartum office visits up until at least a month with baby, and then continuing on with mom, depending on their postpartum visit schedule. So let's say that you're really planning on having your career be primarily in the hospital. What does this course have for you? Well, first of all, even if we're not newborn's primary care provider, we are moms, and moms will be asking us questions. That's just kind of how it goes. So whether that's during your postpartum rounds in hospital, or whether that's paging about questions, calling questions, clinic questions, it's valuable for us to know the content so we can engage with mom's concerns. So maybe that has to do with, I was just at the pediatrician's office and they said I had a tight tongue tie, the baby did, and so they're going to clip it, and now I'm wondering about breastfeeding, and so to just know that content and be able to engage in that content helps provide better care for mom. And breastfeeding support really is a big deal in this grand scheme because we are mom's primary care provider. And so for us to be fully versed in issues that moms can have with breastfeeding, but also babies, helps us provide better care for mom. And in some situations, you may find yourself being baby's care provider for many blippets of time in that first month during your scope. So, for example, maybe mom's got really bad nipple yeast and she comes in. You could treat mom for her nipple yeast, but then if she brings her baby too, you may also decide that you're going to treat baby's thrush, as opposed to sending her back to a pediatrician to have the thrush treated. So that could be a judgment call on your part to take on the baby for a short amount of time for something like that. So the breastfeeding support then plays a big role. Okay, so let's transition then to looking at the document. So ACNM core competencies, this is the document that I was referring to earlier. So you can see here at the top, this is the section related to care of the newborn. So I'm just going to read this first sentence to us. It's a long one. So we should be able to independently manage the care of the newborn immediately after birth and continue to provide care to well newborns up to 28 days of life, utilizing the midwifery management process and consultation, collaboration, and/or referral to appropriate healthcare services as indicated. Okay, so let's just look through kind of what falls under that. So in a nutshell, that's what we can do. These aren't super sick babies. These are well newborns, maybe with some common problems here and there, but overall it's not as though we're taking care of anything too crazy. So we should be able to apply knowledge, skills, and abilities to the newborn. That would include the following. Having a sense of both mom and baby's history and what kind of risk factors would come out of that for the newborn. Preparation and planning for birth based on the assessment of how baby and mom has been doing. Methods to facilitate physiologic transition to extrauterine life. So what does that facilitation look like? I'm just going to scroll down here. A lot of this you'll feel like, you know, I already have the knowledge for this. We've already covered some of this in reproductive physiology. I'm already halfway there. Great. So that would include helping baby establish respirations, cardiac support, such as clamping and cutting the cord after the birth, thermoregulation, helping with that initial feeding and ensuring that blood sugars are stable postpartum, helping to facilitate healthy bonding with families postpartum, being able to pick up on deviations from normal and know either how to manage or how to consult and refer accordingly. Emergency management, basically NRP. And then for evaluating the newborn, being able to conduct the initial physical exam. That would also include gestational age assessment, behavioral assessment, and then being able to do ongoing assessment and management for term newborns up to 28 days. And honestly, that right there is probably about half of our class, is being able to conduct a thorough newborn exam. One that is worthy of being the only one they get before they're discharged from the hospital or the birth center or before the midwife leaves the home. So a sufficient one that ensures, yep, we're stable, yep, we've transitioned well, there's no need to have further monitoring. So identification of deviations from normal and knowing how to consult, so that would be part of that physical exam too. And for those of you who are used to doing a lot of newborn exams, the main difference here would be thinking about being able to be the primary diagnoser in these cases. So being the official one managing it rather than simply finding findings. Okay, and then being able to develop plans with families based on national guidelines. So that would include teaching about normal behaviors and promoting healthy attachment, talking about feeding and weight gain, so a lot of breastfeeding support there, breastfeeding problems. We'll spend a full week just on that. Normal daily cares, interactions, and activities, so sleeping practices, creating a safe environment, that sort of thing. And then provision of preventative care that includes but is not limited to everything they would typically get in the hospital or within the first couple days for an out-of-hospital practice, like vitamin K, eye ointment, all the screenings that are recommended currently. So we've got a week on that as well. And then just the need for ongoing preventative health care, helping newborns safely integrate into their families, and then appropriate interventions and referrals for abnormal conditions. So that could include congenital malformations, poor transitioning, symptoms of infection, infants born to mothers with infection, postpartum depression and how that can impact the newborn, and then any kind of end-of-life care like stillbirth. And then lastly, just any kind of health education that would be specific to a mother and her particular needs with her newborn, in helping mothers access resources in their communities. So that's basically it. I think it should be a really good semester, and I hope that even just going through the core competencies meticulously, that just gives you confidence. Yep, this isn't going to be too hard to master. It's not a super hard class, but I think you'll find it fun. And I also think just seeing the core competencies, it lets you know what you're going to need to be studying for boards. So, and that document speaks for every class that you're in. That document is a nice rubric of sorts to think about what you need to know for boards. All right, have a good week, everybody.